Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. Today, we're going to be chatting about labiaplasty. That's right, labiaplasty. It's one of those things that you say that makes you chuckle because it's like maybe it's inappropriate or something. At any rate, it's a really important topic because it's a procedure that can potentially help a lot of women. And because it has a little bit of stigma associated, it's one of those things that people discuss in secrecy or don't discuss or don't know a lot about. So we're going to kind of dive in deep on labiaplasty. I've chatted and touched upon it in the past on other shows, but we're going to do a whole segment dedicated and devoted to labiaplasty. All right, so easy breezy. Let's dive in. What the heck is a labiaplasty? And labiaplasty, as the term states, is alterations, plasty of the labia. So there are two, let's do a quick anatomy. The female anatomy of the external genitalia is you have a clitoris, that's the stimulatory area. You have skin over the clitoris, that's the clitoral hood. You have the outer labia, which is the wider one, and then you have the inner labia, which is the thinner, more stretchy tissue that covers and closes the opening into the vaginal vault. So that's the basic anatomy. All right. So a labiaplasty is alteration, and in most instances, 90 some odd % of it is reduction or removal of excess labia minora or the inner labia. We don't really manipulate much of the outer labia because the outer labia really doesn't do much. It usually doesn't. It almost never expands. The only thing that happens to the outer labia is as one gets older and loses a lot of estrogen and loses a lot of body fat, over time, the outer labia get a little flat and maybe lose a little bit of cushion to them. But that's not the topic of today's discussion. Today's discussion is about the inner labia, known where we do the labiaplasty. So that is what a labiaplasty is. It's performed because the redundancy of skin that some women have can be a problem. Now, if you are a woman with excess labia minora redundancy of skin and it doesn't bother you, well, then it doesn't bother you. So, and it's not a problem. But for a lot of women, it is a problem. And what are the problems that it creates? Number one, for a lot of people, it's aesthetically undesirable. They don't like the way it looks. They create self-consciousness when they're with their life partner. They don't like the way it looks. That's one. Two, it creates hygiene-related issues. That's a lot of redundant tissue. It's an area that in general is warm and moist, a lot of bacteria. And obviously, when you don't have these folds, it's easier to keep your hygiene. So that's another thing. For some, it's an impediment during intercourse because the redundancy of skin can cause pain and discomfort during intercourse if the skin gets sort of friction or is involved or pulled into the action. And last but not least is the visible deformity that one may see with tight clothing, like bathing suits or jeans or undergarments. So for some women, it is a problem. And knowing that it can be corrected is a huge deal. So why does this happen? Sometimes it's genetic, right? You're just born with excess labia, larger labia, just the way that it is. And in some instances, it's due to childbirth. The engorgement of that area during childbirth can also contribute to it. And like I said, that's just, for some people they have it and some people it happens with time. Okay. So I have this. Am I a good candidate? And the answer is, yeah, it's a relatively, I hate to use the word minor because my philosophy, nothing in surgery is minor, but in comparison to a facelift, it's relatively minor. You're removing, like in an eyelid surgery, redundancy of skin. So if it is bothering you and you have redundancy, then you're a candidate. It's pretty straightforward. Okay, where do I go? Who's going to do this for me? Well, this is a subject, it depends. Historically, plastic surgeons were the gatekeepers of cosmetic procedures, right? 20 years ago, You wanted your nose done, you went to a plastic surgeon. 20 years ago, you wanted labiaplasty, you went to your plastic surgeon. Today, now there's almost always alternative people doing things, and it's usually the gatekeepers, the people who have access to these patients. So what does that mean? So when you are having issues breathing and you want your nose fixed, you're usually at your ENT, who now does rhinoplasties, right? They're doing nose jobs. So you can go to a plastic surgeon or you can go to an ENT. If you have excess redundant labia, who are you normally seeing? Your OB, your obstetrician gynecologist, person who delivered your babies. And they are now doing a tremendous amount of this labiaplasty cosmetic work because A, they're there, meaning they're down there, and B, because you trust them and they're already your doctor. I'm not going to get into the good, the bad, the wrong in terms of whether or not they should or shouldn't be doing it. But I will tell you that because the cosmetic surgery is very results based, meaning aesthetic, you can sort of choose for yourself. But the predominance of people doing them are either your plastic surgeon and or your OB or your obstetrician, and you can figure that out for yourself. Okay, so I got it. So I have this redundancy, and then you're going to remove it. What are the techniques? How do we remove this? This is where I tend to have my own philosophy. I think that in the area of labiaplasty, some physicians, in my opinion, overcomplicate a relatively basic concept. The labia is curvilinear, there's redundancy, and I use a technique kind of like a linear technique where you just remove the excess along the entire surface of the labia. So you just remove the redundancy and close. That's a relatively straightforward concept. There are other more complicated techniques that some people use. I don't want to say that it always is the case, but I think a lot of it is just unnecessary marketing and hype to make yourself seem like you're some specialist or expert in labiaplasty. I mean, if someone's entire career is predicated to labiaplasties, you got a problem. I'm a board certified plastic surgeon that does probably 200 procedures that I'm trained to do. If all I did was labiaplasties, then I don't know what to tell you about my training. So I'm very anti that concept that, oh, my surgeon is world renowned in labiaplasties. It just doesn't make any sense. So I am a big fan of a technique known as just a linear excision, where you just remove the redundancy kind of straight. Can my insurance cover it? As far as I know, I don't think insurance covers it. I think you'd have to have a lot of documentation that you're getting tons of infections and things of that nature. Usually, as you know, insurance companies don't want to pay for breast cancer or ruptured appendix, let alone labioplasty. So I would suspect that you're going to have to pay out of pocket. The good news is that, relatively speaking, in comparison to the overwhelming majority of cosmetic surgeries, this one isn't that expensive, and it's simply just not as involved. So it shouldn't be that as expensive as others. But I don't think you're going to get your insurance to really cover it. And the effects are pretty powerful, right? I mean, I've had women come back and say, oh my God, this was the most rewarding procedure I've ever done. And of course, if as a man, I wouldn't know exactly, but I get it. You have this redundancy. It highly impacts you during intimacy, both from a visual standpoint as well as an ease, a comfort standpoint in terms of not having friction. And you feel like you can wear garments without having to feel tight and uncomfortable, etc. So I think that the satisfaction rate is over the moon with the procedure. But like all things, mole removals, Botox, facelifts, it has to be done correctly. All right, we're going to take a quick break, and then we'll jump back and continue on discussing labioplasties, what you need to know, how to stay out of trouble. All right, we'll be right back with Plastic Surgery Uncensored. All right, welcome back to Plastic Surgery Uncensored. Hope you're enjoying this topic of labioplasty. Let's dive right back in and continue on our journey discussing the things you need to know. So what the hell can go wrong with a labioplasty? You're just telling me this. It's just pretty straightforward. I think the biggest issue, it's not going to be, infections and things. It's over resection. someone removed too much of your labia and now you don't have enough. Okay, well, what the hell do you need it for? The inner labia keep your vaginal opening closed so that it can stay moist and have the right environment and the right humidity and all those things. So you can't just get rid of it. It's there for a reason. You just don't want it to be extreme or excessive. So because it's a stretchy like foreskin and areolas, because it expands very easily, a non-skilled surgeon may remove too much, in which case you're left with a deficiency. That is not correctable. In addition, you may have a lot of asymmetry. Now, it is super common. I'd say 90% of women who show up with labial excess, it's asymmetric. Like the right doesn't even come close to looking like the left. Eyelids, breasts, ears, they're all asymmetric. But labias tend to be really asymmetric. So it's very uncommon for them to look the same, and they should look pretty similar afterwards. Scars I have to say, the scars feel pretty good. The labia is very forgiving. It's just the type of skin that it is. And I've never really had anyone ever complain or ask me, for that matter, from other surgeons to revise their scar. I've had people come and say, hey, they removed too much. Can you help me? And I can't, but I've never had the scar be a real issue. I think the biggest concern with it personally is just removing too much and it can't come back. And then finally, the recovery. Is this, oh my God, you're operating on an area that's so sensitive. It must be horrific. It turns out that it's not. Labiaplasties are moderately uncomfortable for the first 10 days. And once the sensation, the sort of, it's usually like kind of a burning, itching feeling is gone. It's really pretty straightforward because, again, there's no muscle involved. It's just skin, and it's an area that doesn't really have much weight on it. You're not going to be able to, A, ride a bike, B, ride a horse, C, be involved in intimacy for probably about 2 months. But other than that, it's a really mild recovery. You can kind of go back to work after a few days. So the recovery isn't terrible. I think the exchange, from what I've been told by patients, is very high. And I think in general, it's a very rewarding procedure for patients in regard to the exchange. Now, there is some adjuncts or things you can do in conjunction. This is all part of what we call genital rejuvenation, vaginal rejuvenation. Sometimes people have a lot of redundancy of the skin above their clitoris. So that's called a hood reduction. That's also removal. Sometimes, like I said, the outer labia have lost a lot of volume, and you could do a little bit of fat in there to make them more full and cushiony during intercourse. So there are these other adjunctive things. There are also surgical procedures you can do inside the vaginal vault itself due to stretch during babies. Those are all adjuncts, but I would say the main event in most instances in and of itself is the labiaplasty, and it can be done from anywhere under local, I know that sounds crazy, all the way under general anesthesia. And this is where you're going to see a pretty big distinction. As a plastic surgeon, I do everything under general anesthesia. You go in, it's 1 hour, boom, bam, you're done, you go home, it's over. A lot of the obstetricians, OBs do them in their clinics under some local, maybe they give you some conscious sedation. It's a really straightforward procedure for them. I don't like to do procedures in the clinic, just altogether not my style. I like patients asleep and I like them to go home. So in a nutshell, that's the A to Z of labiaplasties. Again, who is a candidate, recovery, risks, and ultimately expected benefits. Hopefully you learned a little something on labiaplasties. As always, I hope these podcasts are beneficial, educational, interesting, whatever you may see. If you enjoy the podcast, we would love some feedback. Feedback always allows us to keep going. So if you can say something lovely, write a review, tell us what you think, we'd be grateful. But more importantly than the positive reviews, we would love for you to share it. right? Subscribe and download yourself and send it to friends, send it to family members. You never know who's interested in plastic surgery. They're sometimes not going to tell you. And if you think this information is educational and prevents them from making a catastrophe, then just send it to them anyways, and hopefully they'll gain something. As always, I'm signing off, Dr. Rady Rahban. Join us next week on Plastic Surgery Uncensored.